As Canada sees mask mandates implemented nationwide, despite not all areas being equally affected by the Wuhan flu or the massive number of predicted deaths ever coming to fruition, there's a lot of conflicting information on the risk versus the benefit of masking the general public. In 2013, the Canadian Agency for Drug and Technologies in Health, whose slogan is evidence-driven, published a review of relevant literature which clearly states no evidence was found on the effectiveness of wearing surgical masks to protect staff from infectious material in the operating room. Of course, this is specific to sterile, air-conditioned environments. Now, imagine masking the general public in all indoor spaces, regardless of sterility, and compound that with masking people outdoors in a heat wave. Then, of course, we see the people who keep their masks in their pockets and purses or hanging from their rear view mirrors, who pull them down to their chins and constantly pull up the nose portion because it falls down. This is not sterile, but in general, the public hasn't been taught otherwise. Meanwhile, the World Health Organization confirmed in their most recent report, posted on June 5th, that at the present time, the widespread use of masks by healthy people in the community setting is not yet supported by high quality or direct scientific evidence, and there are potential benefits and harms to consider. As it turns out, dentists have recently highlighted one of these harms. It's called mask mouth, and dentists claim that they've seen a 50% increase in patients presenting with gum disease and oral decay in people who have never had issues before. Quote, "We're seeing inflammation in people's gums that have been healthy forever, and cavities in people who have never had them before," one dentist says, and another one writes, "Gum disease or periodontal disease will eventually lead to strokes and an increased risk of heart attacks. People breathe heavily through their mouths when wearing a mask, which is inadvertently causing dry mouth. The mouth breathing is causing the dry mouth, which leads to a decrease in saliva. And of course, we know saliva is what fights the bacteria and cleanses your teeth. Saliva also helps neutralize acid in the mouth and helps prevent tooth decay and gum disease." Now that dentists have started to sound alarm bells, the WHO has issued new guidance advising people against dental visits until more is known about the Wuhan flu. Of course, the WHO dental officer goes on to say, "The likelihood of COVID-19 being transmitted through aerosol or microparticles or airborne particles today, I think, is unknown. It's open to question, at least. That means that more research is needed." The common theme with these health advisors and public safety mandates seems to be based on a lot of theories, unknowns, and hypotheticals. Why can't we flip that switch and simply say, we don't know enough about the harms and risks of masking the general public, so we're going to wait until more research is conducted before mandating a broad and far-reaching policy with no end date? Nope. Instead, our unelected public health overlords mandate something based on polling and not actual clinical evidence. Where is the health in public health? So far, all I'm seeing is a tight clinging to a narrative that is proven in real time to be false. I'm Tamara Ugolini with Rebel News. Do you want to fight for freedom? Are you seeing the hypocrisy and mockery that are the protocols and guidelines being put in place by overlords across the country? Head on over to rebelnewsstore.com to purchase some apparel with witty taglines like "Keep Calm and Fight for Freedom" or our COVID-19 84 stickers and "Make Canada Great Again." Every contribution from our audience helps ensure that we will continue to bring you the other side of the story. That's rebelnewsstore.com.